you struggle with high blood pressure and are trying to get off of blood pressure medications, or your blood pressure is not responding to medication and you struggle with chronic pain, then watch this video till the end to find out the connection between the two. Hey, I'm Dr. Sam McDonald, brain health expert, helping you rewire your brain so you can live a better life. If you love this content, make sure to like and subscribe so you get the notifications for each week's new video. So almost all hypertension cases or high blood pressure cases are known as what's called primary hypertension, formerly known as essential hypertension. In essence, what this means is that you have high blood pressure, but there's no correlated medical condition to this. Now understand that there's still underlying physiological problems happening in the body, which is obviously causing the hypertension, but we need to understand the underlying neurological mechanisms to really get this under control so that you then can get your blood pressure and the rest of your neurology, physiology under control. So to answer the question, does chronic pain cause high blood pressure? The answer is yes. Right, let the cat out of the bag early in this video. Yes, it absolutely does. But what are really the connections or mechanisms between this? So primary hypertension does not have a quote unquote known medical condition attached to it, but understand how the body works. So when you are in a pain condition or a pain syndrome, whether it's a short term, you sprained your ankle, or potentially a long term, hey, this particular body part hurts all the time, this is going to start to increase the function of your fight or flight nervous system. Your fight or flight nervous system is responsible for survival. Imagine a fire alarm going off all the time and you're having to escape a burning building. You obviously want higher blood pressure because your heart rate is going to be elevated. Now, an elevated heart rate will then drive the high blood pressure piece here because they work in tandem. You can't have one without the other because we're moving more blood through the system. Again, think surviving the burning building. So when the chronic pain is always there, what's happening is it's starting to rewire the actual neurology of the brain because you're in this chronic survival state all the time. Chronic survival mechanisms mean higher blood pressure over longer periods, and you start to change even underlying mechanisms in the brainstem, particularly a part of the brain called the pontomedullary reticular formation, where you start to increase the other underlying sympathetic fight or flight mechanisms. So chronic pain increases your fight or flight tone, aka sympathetic tone, which then means you're going to start to have problems sleeping. Now you start to have problems sleeping. Now you wake up the next day, you're more exhausted, you're more tired. Now your pain thresholds start to come down even more and your pain starts to go up. This repeats this entire cycle, and again you start to have more and more pain issues, more and more problems with hypertension, high blood pressure going up. Next night comes around, same result happens. You can't get comfortable, you can't find a good position, you're waking up during the night, you're not getting the proper rest that you need. Boom, same thing happens. Now pain comes up again, now sleep and whole stress system goes up even more. Now this starts to layer into other problems too, because when we get into this chronic fight or flight state, you'll start to notice again changes in energy levels because you're not sleeping, changes in digestion because when you're in a chronic fight or flight state, you're not going to be digesting food well. Now start to stack this over days, weeks, months, years. People start to get other comorbid conditions or other diagnoses, things like diverticulitis, problems with ulcerative colitis, Crohn's disease, all these other things can start to pop up because of the system being stuck in this fight or flight state. Now you start to look at other types of mental wellness type conditions, things like anxiety or depression. You start to get problems with anxiety because again, your system is constantly looking for this danger that's really not there, that's being driven by this chronic pain syndrome. Depression can set in because as the body starts to have this chronic pain issue, you start to get a decrease in the connection to that particular body part. Now, all of our bodies connected up to our brain. If let's say you have a problem in the hip or the shoulder is going to fire up into the part of the brain called the cerebellum, movement, balance, coordination, which then connects into our parietal lobe. Our parietal lobe is the map of our body. When we don't have a good map of our body, it stops firing up to our frontal lobes, which is really where a lot of these mental wellness conditions really occur. So problems with anxiety, depression can be linked to chronic pain because of what's happening up in the shoulder. So you can start to see very quickly as the physiology starts to break down, then you can start to have all these comorbid conditions going on. Again, digestive problems, increased heart rate, high blood pressure, anxiety, depression, sleep issues, focus and attention problems, cold hands, cold feet. All these things can start to stack up because the physiology is now functioning in an improper way. So the most important thing you need to do is address the chronic pain first, ideally in a non-pharmaceutical manner, because you really need to understand what's happening with the neurology, correct that so the pain can go away, or the biomechanics if it's a mechanical pain type issue, and then start to go in and correct the underlying dysfunctional neurology. So find a practitioner who can help understand what's happening in all these different levels to get you back to living that optimal life that you want to live. So on that note, you should be healthy by choice, not by chance. And for that reason, I will see you on the next video.